Dr. Gregory Thoreson is a board-certified urologist with Urology Clinics of North Texas. He received his Doctor of Medicine from University of Texas Health Science Center in San Antonio and completed his residency at the University of Texas Southwestern Medical Center in Dallas. Dr. Thoreson specializes in treating a wide variety of urologic conditions in both male and female patients, including kidney stones, enlarged prostate, urinary incontinence, erectile dysfunction, and low testosterone. We have a lot of great content to cover tonight. So Dr. Thoreson, I'm going to turn it over to you to get us started.
Abraham, thank you for the introduction. Good evening, everyone, and thank you for joining. Tonight, we're going to be talking about just a general overview of the prostate, as well as various treatment options that are available for hyperplasia of the prostate. Just as we get started, as a brief overview, the prostate as a whole, it's a reproductive organ, sits deep within the pelvis. It borders both the bladder as well as the urethra. And the prostate over time will eventually grow in most men. And, tonight we're going to talk about some of those symptoms that may be associated with that growth. There's various conditions that affect the prostate, and they actually exist independently, but they are somewhat correlated in that they could potentially have symptoms that overlap as well. So with regards to hyperplasia of the prostate, we're just going to get into that. So what does it mean when we say BPH? It just stands for benign, so like a non-cancerous condition, prostatic, of relating to the prostate, and hyperplasia. So that's an abundance of cellular growth. The normal adult size is somewhere around 1.5 inches in diameter, but that can change over time. If hyperplasia of the prostate exists, there's a chance that it could potentially obstruct the flow of urine, so we call that bladder outlet obstruction. And then those potentially lead to lower urinary tract symptoms, sometimes referred to as LUTs. And then, when people have hyperplasia of the prostate, they often ask, is this related to prostate cancer? And that's kind of a challenging question to answer because they could potentially exist at the same time. So we treat these two conditions separately. With regards to the evaluation and management of prostate cancer, it's different than that of hyperplasia of the prostate. These are often performed by urologists that are comfortable performing both of these things. So these are things that normally go hand in hand at the time of your evaluation for hyperplasia of the prostate. With regards to a normal versus an enlarged prostate, most men in their youth rarely have any issues. So that's kind of the reference point that a lot of people say. As we age, if your prostate grows, you could potentially impinge or obstruct the flow of urine, potentially leading to urinary retention as well as symptoms. With regards to symptoms of hyperplasia of the prostate, one of the biggest symptoms that we hear about is just kind of a weak flow. That's kind of where we really start, listening and starting to think about obstructive urinary symptoms, potentially secondary to hyperplasia of the prostate. Other things that sometimes accompany that would be painful urination, which might be related to either malignancy or an underlying infection, that sensation that you aren't able to empty completely, that's kind of related to hyperplasia of the prostate, as well as frequency of urination. And all these things are actually interrelated. And the majority of men who have moderate to severe lower urinary tract symptoms actually report, that this is very unhappy to them and they would like to see this changed. This kind of trickles over into aspects of their normal life, potentially affects, those that are around you. And then there are secondary effects associated with sexual performance and sexual function. So in terms of who gets hyperplasia of the prostate, it's an extraordinarily common condition. If you go out to older ages in life, those that are 85 or above, the majority of men actually have obstructive urinary symptoms. And around the age of 60, about half of men have that. In terms of, factors that potentially increase the risk of hyperplasia of the prostate, we say that obesity, a higher BMI, as well as a lack of exercise could potentially increase the risk of hyperplasia of the prostate. And, we estimate, by 2010 standards that roughly 14 million men in the United States had lower urinary tract symptoms. So how is an enlarged prostate diagnosed? We often do it by taking a good history and physical examination. We often do a digital rectal examination. We also do urinary output testing conducted here in the office. One of the easiest ways to quantify your symptoms is to perform an AUA symptom score or an International Prostate Symptom Score. But then we also ask about quality of life questions as well too. With regards to treatment options, a lot of times we start in the conservative range, and that's where most people feel comfortable. And we'll get into that. We also talk about the rate of invasiveness as well too. So, with regards to conservative treatment options, we often talk about fluid and dietary changes, as well as watchful waiting, as well as Kegel and bladder retraining. With regards to dietary supplements, it's important to note that there are really no effective vitamins or supplements that really help men with hyperplasia of the prostate. And this includes saw palmetto and other medications that are similar to that as well too. I think it's important to reinforce that. With regards to watchful waiting, which we introduced briefly, it may involve lifestyle modifications such as adjusting diet, adjusting your fluid intake, and the timing of that, as well as exercise patterns. This is often the easiest thing to do, but most men aren't overall satisfied with this over time, and symptoms may worsen. One of the first places that we often start is with alpha blockers, and there's about 6 drugs in this space. With regards to how this affects men, a lot of people talk about having a stuffy nose associated with this. Some people have a drop in their blood pressure. And there's also drug interactions that may take place with other medications. The way this works is by relaxing the muscle fibers present at the bladder neck, allowing the urine to flow more freely. The next drug class that we often talk about in this space are 5-alpha reductase inhibitors, or 5-ARIs. These work by effectively reducing the growth of the prostate. These take about 3 to 6 months to really kick in before we start seeing any side effects associated with this. There's some side effects that come along with this that most men are not too pleased about, and that has to do with sexual performance as well too. And of note, for both of these drug classes, 71% of men stop taking the medication within a year. With regards to Resume water vapor therapy, it's an outpatient therapy that uses natural energy stored in water vapor to shrink excess prostate tissue. They recently came out with 5-year data associated with this treatment, showing a 4.4 surgical retreatment rate through 5 years, which is truly impressive. Some of the side effects associated with this would be painful or frequent urination. You can also have blood in your urine or your ejaculate. You can also have a decrease in your ejaculate volume, as well as a urinary tract infection and an inability to completely empty the bladder, as well as an urgent need to urinate as well. So going into the mechanics of it, we've prepared a video for you, which I'll be playing.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right, and we will continue to one other video associated with resume.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Resume procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Resume treatment has made a very big difference in our life.
All right, so, in addition to Resume, oftentimes prostatic urethral lift is discussed in the same space. It's in the kind of same space, so it's important to kind of talk about it at the same time, but the mechanics associated with it is an outpatient procedure in which prostatic urethral lift implants are placed within the prostate such that the prostate tissue is effectively pushed or kind of compacted to allow an inner channel in which you can urinate through. One of the things that's important to note is that with regards to the surgical retreatment rate in 5 years, it was marked at roughly 13.6%, which is higher than what we would like. Some of the side effects are pretty similar to that of Resume, but they're also unique in that you can sometimes get urinary stones attached to any clips that may have migrated into the urinary bladder. Those that exist within the prostatic urethra normally do not have any issues, and it's unusual to actually have one within the urinary bladder, but it is possible. You can also have blood in the urine, blood in the ejaculate, urgent need to urinate, inability to urinate, so it's all very similar in that same regard. Another technology that's worth mentioning is green light laser therapy. So this is an outpatient procedure performed under general anesthesia. It does have a surgical retreatment rate of 4.8%, which is good. With regards to the side effects, again, it's pretty similar in the kind of same regards as we've been discussing all night tonight. One of the other things that's unique for this is potential scarring or narrowing of the urethra, narrowing of the bladder neck, similar to a bladder neck contracture, as well as a reduced ejaculate volume or dry orgasm, as they would say. There's also some associated erectile dysfunction potentially associated with this treatment. With regards to how this is performed, we also have prepared a video for this as well. So TURP is commonly referred to as the gold standard. It's a procedure that we've been doing for roughly 90 years or so. So it's been around for quite some time. With regards to the surgical retreatment rate, it's about 5.8% at 5 years, so roughly 1% per year, right around there. Side effect profiles also very similar that we've already discussed in comparison to green light laser prostatectomy. Of note, the two things that make both Resume and Urolift or prostatic urethral lift unique is that there's generally a preservation of uroejaculate volume over a TURP or green light laser prostatectomy. With regards to prostatectomy as a whole, this is really referring to a simple prostatectomy. This is an outpatient procedure that requires general anesthesia, same as the last two things that we have mentioned. Side effect profile is pretty identical to this. We do this now most of the time with robotic or robot-assisted laparoscopic surgery. This does involve a hospital stay associated with it as well, too, generally speaking. With regards to insurance coverage, it's the responsibility of the patient to contact their insurance provider for specific coverage information. So, in summary, we talked about the prostate, how it works, as well as hyperplasia of the prostate, as well as the associated treatments, including but not limited to watchful waiting, first-line therapies, as well as surgical procedures. In terms of next steps, consultation with your urologist is recommended to determine which therapy is the best treatment option for you. At this point, we're going to turn it over to Abraham. And, we're going to be going through the questions that were submitted in the chat box.